Hello, my name is Nareen Anwar, and I will be presenting my research which examines brain function in obesity and assesses the impact of bariatric surgery on brain function. Obesity is an ongoing epidemic that is linked to a variety of health concerns, which not only include cardiovascular issues, but also a variety of neurodegenerative diseases. The brain plays a crucial role and is essentially the master controller when it comes to our satiety. Bariatric surgery is an effective and long-term weight loss solution that not only makes changes to one's digestive system, but can also improve neurocognitive function. We previously reported decreased cognitive function in obese participants when compared to age-matched healthy control volunteers, and we also reported an increase in cognitive function after bariatric surgery. In this research, we sought to assess another crucial aspect, the energy budget of the brain, also known as cerebral metabolic rate of oxygen, or CMRO2, in obese subjects and how CMRO2 changes with bariatric surgery. However, the mechanisms that drive these improvements are unknown. Changes in BMI or CMRO2 occur as a result of bariatric surgery, and these changes are observed in this study. Magnetic resonance imaging, or MRI, was utilized to non-invasively assess CMRO2 in bariatric surgery candidates before and after their surgery. These values are compared to those of age-matched healthy controls and to those of young healthy controls that are used as a reference. CMRO2 is calculated using four values as represented in the equation above Figure 1. Cerebral brain flow, or CBF, represents the amount of blood flowing into the brain and can be quantified using a non-invasive phase contrast MRI technique. An imaging slice is placed perpendicularly to the four arteries in the neck that carry blood to the brain, the right and left internal carotid arteries, and the right and left vertebral arteries. Figure 2 shows representative phase contrast images of each of these arteries. An in-house built MATLAB script is used to calculate each of the blood flows in each artery, and these values are added together to calculate the total blood flowing into the brain in the units of milliliters per 100 grams of tissue per minute. Arterial oxygenation, or YA, is assessed by using a simple pulse oximeter connected to the fingertip, while venous oxygenation, or YV, is measured using a technique called T2 relaxation under spin tagging MRI, also known as TRUST. This imaging technique is performed on the sagittal sinus that drains venous blood from the brain. Signal intensity from the sagittal sinus is obtained at different echo times and is then fitted to obtain the T2 value of the venous blood. The T2 value is then converted to venous oxygenation, or YV, using a calibration plot from literature. Finally, CA is also obtained from literature, and it represents the oxygen carrying capacity of blood. Together, these four values are used to calculate CMRO2 for each subject. Our results showed that the BMI of obese bariatric surgery candidates decreases over time post-surgery, as shown in Figure 3. 2 weeks after surgery, the patient's average BMI was reduced by 5%, and after 14 weeks, it was reduced by 13% compared to pre-surgery. Additionally, the average CMR2 value of bariatric surgery candidates before surgery was significantly different than that of the age-matched healthy controls. It was 29.5% higher. Furthermore, the average CMR2 of the patients 14 weeks post-surgery was 7.5% lower than the pre-surgery CMR2. These trends can be seen in the data represented by Figures 4 and 5. Bariatric surgery was able to effectively reduce BMI in the severely obese patients. Taken together, these results suggest that severely obese bariatric surgery candidates have a significantly higher CMRO2 than their healthy age-matched counterparts. We can say that bariatric surgery is not only effective at reducing BMI, but it also normalizes CMRO2 in obese patients. After 2 weeks post-surgery, the CMRO2 of the patients was still elevated compared to the age-matched healthy controls, suggesting that the patients had not yet fully recovered from the surgery. However, 14 weeks post-surgery, the patient's CMRO2 is similar to that of their age-matched healthy counterparts. Altogether, this suggests that the bariatric surgery normalizes the CMRO2 in the brain of severely obese patients in a mere 14 weeks, and decreased CMRO2 is directly linked to improvement in brain function. These findings need to be confirmed in a larger study, contrary to this pilot study, but the results seem promising. I would like to thank all the participants of the study, the pilot program grant provided by UT Southwestern, and all the additional help I received during my research. Thank you so much.